In
This
the last,
conference will now be recorded.
in the last class, I think we were discussing about transdermal drug delivery systems, and if at all, I don't know how many of you have a habit of writing it down. You're able to see the slide? Is it clear?
Yes, sir, it's visible.
Yeah, good. So I was just, I think because I'm not sure of the last slide which we did in last class. Uh, anyhow, I think I was discussing about what are the drugs which are best suited for transdermal drug delivery, or all the drugs may not be suitable for transdermal drug delivery. That's what the point is. What are the specific features of that drug so that it's an ideal candidate for transdermal drug delivery, or development of drug delivery. These are some of the points, very important points which everybody is supposed to know. Okay, any developmental scientist, uh, yeah, there is a disturbance. Somebody, yeah, yeah. So the drugs which are deemed to be suitable for transdermal drug delivery or development of transdermal drug delivery. Are you able to hear, Rita? Hello?
Yes, sir, we can hear you.
You're able to see the slides, no? Slides are fine?
Yes, sir.
Yeah, the slides are fine. So Nihal is not there?
Yes, sir, I was there.
Oh, but why you are silent? Some people should reciprocate. Hmm? Hmm? Okay.
Sir, your voice is breaking.
My voice is breaking. And that's what I want the input from you people. Is it here now? Now is
Going,
it fine?
sir.
Now is it fine?
Yes, sir.
Oh, yeah. I think here is fine, I think. Otherwise, I'm able to hear it clearly. Right from the beginning, and my voice also here. Is it fine?
Your voice is also clear, sir.
Yeah, thanks. Thanks. I will just move on quickly. Somehow I was not able to take the last class because of unavoidable reasons. Okay. So what are the drugs which are best suited for transdermal drug delivery? So these are some of the features you're supposed to know. One is, first thing is for any drug for through skin, the molecular weight should be less than 400 Daltons. It's a prime what that consideration that needs to be satisfied. The second thing is what should be the partition coefficient. I think I was explaining about that. People would have done the experiment also. Okay, the partition coefficient of the log P value. They are not the same. The log of partition coefficient will be the log P value. Okay, so that should range between 2 to 4. And it should have a low melting point because it is always assumed that drugs having low melting point are more miscible with the stratum corneum liquid. That's the main reason. And most importantly, you can see that a dose, the daily dose, it should be less than 25 mg. Okay, that is what I mean to say. In other words, it has to be potent enough. Okay, so potent drugs are more suitable for transdermal drug delivery, and preferably, many times it's always assumed that drugs which have a shorter half-life of less than 10 hours or something like that, short half-life, are considered to be good candidates. And one of the prime features which needs to be satisfied is that it's non-irritating and non-sensitizing to cause any irritation. Okay, that's one important consideration that needs to be satisfied. Is it clear with the slide, all of you? Yes, please talk fast.
Sir, we are not able to hear you properly because Shweta's microphone is on, sir. So it's
Tell her
disturbing
na.
a lot.
Tell her
Or
please.
else your voice is clear, sir, but because of her disturbance, it's not.
Yeah,
We are
yeah.
not able to hear you
I
properly.
could sense. But Sweta, are you able to hear? Yeah, just inform, pa. Just inform. Okay.
I
So tell
tried
you again.
calling her, sir, but she's not receiving the call.
Yeah, yeah. It's fine. It's fine. Here you're quite clear for me. So we'll move ahead. But more importantly, what I wanted to tell you people is, I think even for the practice school session, I heard that many of you have opted for conflict. Am I correct? Am I correct or no? Hello? 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 Hello?
Yes, sir, we
Yes,
can
sir.
hear you.
Yeah. Rashita, you're able to hear me? Okay. So many of you would have opted for conflict. Welcome everybody, in fact, okay, to join the department of conflict. Conflict is one department, what we mean to say, okay, which is mostly concerned with product development. Okay, that is the key. So you can do a lot of things in conflict. Don't assume that conflict may not be a good domain to work in. Okay, because it's always, for example, any product development, for example, it's an added value. So conflict is a very good brand, especially with many of the India now, right now, India also. As there is a disturbance data, I don't know how to percolate it to you. Okay, yeah. So you know that the Prime Minister also has been focusing on what is called as Make in India. Most of you are aware, I think. Yes, is it clear? Hello?
Yes, sir.
So that is the amount of focus what yes, is there on pharmaceutical. Maybe a simple phenol, for example. Yes, my own PhD students were able to prepare the phenol, okay, prepare the hand sanitizers, okay, and supply it to the whole community. That is the impact of pharmaceutics during the COVID. I'm telling you. I'm very proud to tell you this. Okay, it's a simple thing. What anybody needs to do, 80% of alcohol or something like that, and the rest can be aqueous waste. I'm just telling you. It's a simple formulation, like many of you would have done even in your distance. Hello, Bhargavi, anything? Any issue? Am I clear?
Yes, sir.
Shweta is clear. Yeah. So what I mean to say is, it may be a simple phenol. For example, you would have prepared aromatic waters also. Can you recall aromatic water? Yes. Yes or no, Pa? Hello? Nobody remembers? Nobody has any answer. People are appearing for GCAS. And how come? Okay. Any simple preparation would have come? Aromatic water? Nobody remembers anything? You had, na? In your pharmaceutics? Yes or no? Did you have something called aromatic water? Yes? Hello? Hello? If people are not talking, I won't be able to continue. Yes? Can you stop the class then? Tell me. If you're not reciprocating, I won't be able to continue because whatever the exercise I'm doing for 1 hour is going for a waste otherwise. Hello?
Yes, sir.
Yes, sir.
Uh, Vidyashree and Harold, both good, at least you responded. Have you heard of aromatic water?
Yes, sir.
Any one
Like
example? That is what I
peppermint
was
water.
asking. Yeah, as simple as that. Okay. So as you come to know, for even the COVID situation, simple preparations like this have added value, as you realize. So a lot of focus is there towards product development. It may be a simple product development, but it should be we should be able to scale it up. That's the key. And produce in large quantities. Okay. So pharmaceutics is always an added value. Don't assume that it's a simple brand or whatever it is. You can make it as simple as this, aromatic water like what I gave an example. And you can go to as complex as what you can call it. One of the chapters what we're discussing in front of you, that is transdermal drug delivery. Okay. There are very unique products which have come into the market, as you can see. Okay. I will usually for the MPharm students, I talk about nasal gels, okay, which are used in the, which are wonderful preparations, which may come, for example, yes, as a prophylactic in case of COVID. Okay, please read the newspapers, okay, and please try to do something new. You can get involved in simple projects like this, come out with a wonderful idea, is what I mean to say. Is it clear? Yes. So, unless you develop an idea, and ideation stage itself, okay, it's very difficult to see any big light in your life. Not that, okay, I keep advising and inform people. So as long as, okay, try your GPAT exam, and after GPAT also, for example, please come to California Pharmacy. Okay, there's nothing wrong. We have got wonderful laboratories, wonderful infrastructure, all that is there in place. Already. Is it clear? Yes. So some of you, I think many of you have opted for pharmaceutics as a practice school.
Yes,
Yes.
sir.
Here is, yeah. So you would have already had the field, and we have a wonderful pilot plant which you can make use of. Okay. So, so a lot of facilities are there. The only thing is you should have the self-learning ability, self-motivation should be there. It's the only thing what you should have. There are a lot of other resources. Many times I always keep telling there may be very few teachers who are very resourceful to tell you, okay, and who are really willing to help you out. Make use of those teachers and try to come up in life. Is it clear? That's the only advice I can tell you. Okay, and because now India is focusing more on development of products. Okay, the pharmaceutics is a very good branch too. Okay, shall we move forward? Shall we move forward? Do you understand the
Yes, sir.
slide?
Yes, sir.
Uh,
Yes, sir.
yeah, thanks, ma. Thanks. Okay. So, so this slide gives you some of the products which are already available in the market. Okay. Some of them may be there in the Indian market. Some of them are yet to come to the Indian market. Okay. So just have put up a pictorial representation, pictorial table, indicating what are the ailments that may be there and what is the drug that can be used to treat those ailments, and finally what is the product, this is the transdermal product. For example, motion sickness, okay, can be treated with motion sicknesses, traveling sickness. That is what we mean by motion sickness. Some people have a tendency, for example, whenever somebody travels, okay, you have a tendency you just develop nausea. Okay, that is known as motion sickness or traveling sickness. And one of the products that is available in the market is transdermal scope. And one more wonderful product which is there in the market for angina is the nitroglycerin being the drug, nitroder. Okay, so it is used to manage angina pectoris. And similarly, the good number, actually cardiovascular drugs are a wonderful category of drugs which can be given by transdermal route. One more is, as I told you, clonidine, which is used to treat hypertension. And most of you would have come across this nicotine, okay, which is used in case of smokers, chronic smokers. It is used for smoking cessation. Okay, there are some products which are available. Similarly, there are products which are available for hormone replacement therapy. Again, estrogen estradiol is one example. And one more is for pain management. I think it's available even in India. The patch is known as fentanyl patch. Okay, fentanyl again is a painkiller. Okay, yeah, which is used especially in case of chronic pain, especially in case of cancer patients. So this is a broad picture of the example. This is what you're supposed to know. Even M.Pharm students need to exemplify this. In B.Pharm, I've just thrown a light on what kind of products are available, okay, in the market, not only the Indian market, but it's the global market, what else have said. Okay, so the overall scenario. So Indian market also, there are a number of what you can call it as at present, there are a number of what you can call it as NSIDs which are making it to the Indian market. One such example is the new patch. New patch is nothing but diclofenac, okay, which is used especially in management of what you can call it as knee pain, okay, due to arthritis. Is this clear? Is this clear? Are you able to understand? Yes?
Yes, sir.
Yes, we get it. We'll move to the next slide then. So, in case of what you can call it as when you want to develop a transdermal system, a transdermal system or a product, what are the factors that govern the design of such a product? One is therapeutic indication. Okay, basically, as I told you, it is basically whether you have to first see whether it's meant for acute or chronic administration. What is acute? Yes. What is acute? What is chronic? Any differences?
Sir, acute is the condition where it is a beginning or the starting, like,
Ah, ah.
and chronic is severe, sir.
Any slight modification with this chunk, little bit in a more what you can call it, because the people study pharmacology. Okay, I'm basically not a pharmacology teacher, but okay, I would have studied my pharmacology only in my B.Com days, and I want a refined answer. And you're somewhere there, but again not very clear. Anybody else can throw some light? Yes.
Sir, acute lasts for short period, sir.
Yeah.
Chronic lasts for long period.
Yeah. Vidya is very close, as I told you. Acute is something like any particular disease which is short lasting. Something like your fever, ma. Okay, the fever or whatever it is. Okay, it may last only for a few days. A viral infection may last for a few days, like that. Uh, Chronic is a condition where it is almost lifelong. For example, many of the diabetes is one example. Cardiovascular is one example. Many of the cardiovascular diseases, hypertension is one example. Many of the CNS diseases, okay, are other examples. Okay, is it clear now? Are you able to understand? Everybody is clear with this? Yes?
Yes, sir.
Ah,
Yes, sir.
okay. Yes, very clear. Nice to hear. Okay. That acute is only for short duration. Okay, which is going to last only for a very short duration. Any infections, for example, for that matter. Most of the infections may be short lasting. Okay. Whereas chronic is the one which is almost lifelong. Something like I use the word you have to live with it. Okay. Doctors use the word you have to live with it. For example, I have a back pain. Okay. There is no other option. Okay. They have to live with it. Okay. Only thing it is lifestyle management, what people call it as. Okay. So it's like this. Okay. Is it clear now? So that is what you need to think about when you're developing a product. For example, whether it's meant for acute or chronic purpose. So transdermal is the one, okay, drug delivery system is the one which is basically meant for chronic use, not for acute. Okay. The other feature what you need to look at is how well the drug is getting released. That's one more thing. And how long the drug has to be released. Is one more thing what you need to look at. Other than that, skin adhesion is one more very important thing. What I mean by skin adhesion is how firmly the patch is going to adhere to the skin. Okay, something like I think girls will be using bindi. Okay, bindi I see many times dropping down also. Okay, a very small bindi, what do people use? Yes, and so that is very a classical example of skin adhesion. How well it is going to adhere, or whether it is getting dislodged. That is what I mean to say. So that is very important even in case of a transdermal patch. I'm giving you a live example, as you can see. Yes, example is classical example is your bindi. Okay, so it should adhere firmly at the microscopic as well as macroscopic level. Okay, next is how easy it is to apply and how long it has to be applied. There are patches, once a week patch also is available. Somewhere somebody applies to the back and it almost will be there for almost 1 week, for example. But again, for the Indian scenario where people have a tendency to wear it everywhere, every day, for example, transdermal patch again 1 week may not be preferable. Yes, just like your handy flash. Okay, something I don't know whether you remember your handy flash. They have come out with some products, something called Band-Aid, wash-proof. People have heard of it? Wash-proof? Yes? Yes or no? Yes? Nobody has come across Band-Aid?
Yes,
Yes,
sir.
sir. Yes,
Ah,
sir.
so thank you would have seen Band-Aid. Okay. Initially it was only the Band-Aid just come. Band-Aid. Band-Aid. Okay. Now what you can call it as the next version of it is it has come as a wash-proof. So what they mean to say is even after the number of washes, for example, somebody applies it to a particular cut or a wound. That is what the main application of Band-Aid. So even though you wash your fingers or whatever it is, which has got cut, okay, once you apply the Band-Aid, they tell that it is wash-proof. What I mean to say is it does not get dislodged. Okay, so that is what we mean by ease of application and application time and skin adhesion. All this you can see in Band-Aid. So Band-Aid, the only thing when you see is a transdermal system is something like a Band-Aid. The only difference is, uh, what is the difference? Now people should be able to tell now. Between a transdermal patch and a Band-Aid, Band-Aid, I think few of you told that you have encountered, but what may be the difference? I want you to think now and tell me. Then I'll move to the next slide. No difference? Is there any difference? I want the people to interact. So only thing I'm ensuring is something has reached by doing all this exercise. Really fast, for example, whatever your parents have provided, I'm telling you, okay, you are relishing that, you are enjoying that. It may be even the online platform, maybe even the data, what you are using. Okay, yes, not all the students, for example, in Karnataka or all over India will have the privilege of doing this. Your parents have done something, at least bare minimum, where you have the data on with you, where you are able to hear what I am talking. Please make best use of it. Is it clear? We are also giving more than 100%, most of the speeches, what I can understand. So try to percolate the information to you people. Please make use of it. Okay, this is a general advice to each one of you. Is it clear? Are you able to understand? Yes or no?
Yes, sir.
Yes,
Ah,
sir.
yeah, Shashank, Vidya, yes, pa. Okay, see, because I always tell, okay, somebody is not sitting and reading the library. Okay, for example, I always make a comment telling that your parents, for example, you are grown-ups now, you are in the verge of finishing B.Pharm. Okay, your parents would have really struggled to drop you to the school. Yes or no? To almost a doorstep of the school. They have carried you back home. You remember all those days in your childhood? How many of you remember? Tell me. Hello? Only I am talking. There's no answers. No parents have dropped you to school?
Yes, sir. Yes, sir.
Yes,
Shashank,
sir.
you should value that, pa. Vidya, Shashank, everybody for that matter. Please value that. Please imagine the difficulties what your parents would have had dropping you to school and picking you back. Okay? Yes? Are you able to understand? Yes?
Yes,
So,
sir.
Yes,
Yes,
sir.
sir. Yes, sir.
in spite of all this, people, Shashank, whoever is at least replying, in spite of this, people don't sit in the library and read. Okay, I feel bad in that context because even my parents did the same thing for me. Unless until you sit and read, you are not going to encash what hard work your parents would have put. Is it clear? Are you able to understand? Yes?
Yes, sir.
Ah, so you're not encashing what you have learned. The simple English what you have learned, you're not encashing it. That is what I feel bad sometimes. Okay. Now everybody has come to know pharmacy is a wonderful branch. Have come into a wonderful branch, really. Okay. Now we have come to know people are realizing the importance. Okay. The intake in our college has been increased from 60 to 100 now this year. That is the importance of pharmacy. What is that? Is it clear? You can really make wonders if you really want. Okay. So give it a proper shape. See that you finish off well. That is what you mean to say. People who just coming to final year, yes, your work is half done. Is it clear? Do well in your final year and come out with flying colors. That's the only thing I'm going to tell you. And as long as it is possible, okay, please try to study or do masters. BPharm may be sufficient for today, okay, but upgradation of your skill is always useful. Don't always think that that is waste, MPharm is a waste. Don't ever have the feeling that. Is it clear? Are you able to understand? Yes?
Yes, sir.
Please pursue your higher education. I'm not telling you, okay, no, do it in our college only. I'm not telling you. Again, depends on your access, wherever you are. Okay? So, realize all this importance. I'm trying to percolate something to you using the online platform. I'm trying my level best. Your parents have, okay, are liberal enough to provide you the data. Make full use of it now. Otherwise, everything goes for a waste. Is it clear? Are you able to understand? Yes?
Yes, sir.
People are really, I'm telling you, okay, are launching their own videos on YouTube and they're making a lot of money. I don't know how many of you know that. They're known as freelancers. Even I see my son listening to other videos, okay, other than his school videos on YouTube. He's doing his PO, I'm telling you. Whichever he gets fascinated, he upgrades the information or he gets the information. I'm very happy with that. Is it clear? And some of you are going for GPAT coaching also. I know that. Okay. Is it clear? Yes. And try to do the best, whatever said and done. Yes. And just every time, you please remember what hardship your parents would have put. That's the only thing I tell you, Pa. Hardship, what the parents are putting, as well as your teachers. Okay. And you need to encash. Later on, I'm very sure that most of you will repent if you're not doing your thing what you're supposed to do now. Yes, I hope something would have gone to your brains now after me talking for such a long time. Yes, I know I'm deviating from the subject, but still, I'm just telling you what all your responsibilities are, what is expected out of you. For example, at the end of the year, parents expect you to get placed. Okay, for uni, you need to be equipped enough to get placed. We also conduct campus drive, as most of you are aware. Many of them don't show interest. We always encourage you to go to higher education. Yes, you can always go to some prestigious institutions such as NIPER or BITS. And if not, it is not available. You are always welcome to join our college. There's nothing wrong. Is it clear? Are you able to understand what I am trying to percolate? Yes? Hello?
Yes,
Yes,
sir.
sir.
So understand your responsibilities and move on. So the other factors that need to be considered, coming back to the subject, is the, the packaging and the patch cost. Again, the costing of transdermal patches is very much high when compared to conventional patches because the associated manufacturing cost is high. Okay, and when it comes to a transdermal system, please all of you just imagine a band-aid. Okay, I'll not put the picture of band-aid. Okay, now it is known as Hansaplast. Please go and have a look at Hansaplast. Okay, it is something
The
like that.
Ketinova Hydro is an example, sir. That's basically a band-aid. They're used
Hello?
for the Ketinova Hydro.
Ah, ah,
Even that is also transdermal, which is basically applied on the wound. Not applied, just they'll put a patch on it.
that's the reason, Shashank, I was asking you, what may be the difference between, I forgot my question, what I'd asked you.
Yes,
What may
sir.
be the difference between a band-aid and a transdermal patch? That was a simple question what I tried to ask you because you have a scope to think there.
Yes, sir. Yes, sir.
What is the difference?
So it's a transdermal patch where all the medications and all are being added through it, or like some of the chemicals and all, to so that the fungal infection should not be happen. Band-aid, just to prevent from the infection, they'll use the band-aid. But transdermal, the medications and all are used, so slowly it gives the effect on the skin to reduce the wound.
Anything else? The tank is somewhere close. He has made an attempt, good attempt in fact. Anybody else?
So Band-Aid is only for preventing the superficial infection and preventing it from the external environment. And transdermal, the drug might penetrate into the skin, sir.
Yes, somewhere bit closer, people. Little bit closer. Go to the definition of what you can call it as. What is a transdermal patch? How did we define? All of you will define the transdermal patch. Okay, or transdermal drug delivery. Okay, look at the definition once, and you'll be able to differentiate. Now we are very close to the answer. Anybody else wants to help us? Help Sheetal? Wonderful answer. Shashank also most welcome. Sheetal, good attempt. Okay, Sheetal is more closer. Anybody else then?
Sir, where transdermal patch where active ingredients directly enters to the systemic circulation on the application of the skin, sir.
Uh, which skin? What kind of skin now? Anything did we study on that? What kind of skin?
Dermal skin upon the top layer.
Correct. Shashank, you're closer. Yes. Sheetal also can help him.
No. Then no
I only
ideas.
asked you the difference between what is an Hansaplast or a band-aid and a transdermal patch. Because both are almost similar. People told you are somewhere around, but you're not getting the exact, something like your Google Maps, what people do. You'll be wandering around the parallel road, but you're never reaching the destiny. Yes, Shashank and Sheetal can try. Anybody has the definition in front of them? That's why I tell you people to jot down points. I can make
Sir, it's
out.
a conventional method of absorption of drug through skin, sir. And it
What
reaches
kind of skin?
the
And which one you are talking about?
patches, sir,
What patch?
transdermal patch,
Correct.
through
Ah,
the dermis layer of the skin.
ah. Only one
And
thing, ma.
it
Okay.
absorbs the drug and it reaches the systemic
Ah,
circulation. That is the very next layer of the skin. It has
yeah.
the supply of blood vessels where the drug
Yeah, understood. Got your
absorbs
point.
it.
What you need to differ, what is the major difference is that, as Shashank also was mentioning, band-aid basically it is not for an intact skin. That's the key. What's my point? Shashank,
Yes,
Sheetal got the point. Ah,
yes, sir.
good. That's the reason why I keep telling you. Agree upon. Many teachers will not know the differences. I know that because new age teachers will not know the difference. Okay, many of them I'm telling you. If you ask your teachers, you will not get the answer. Band-aid basically is for a wound where all the epidermis, dermis, everything would have got lost. Is it clear? There's a mechanical damage to the skin. Are you able to understand? Yes?
Yes, sir.
So whatever you apply, directly it goes into systemic circulation. Povidone iodine, for example, when you apply to wounds. Tincture, you apply to wounds. Is it clear? So it enters into the systemic naturally, locally, at least. But whereas transdermal patches, what is the difference? Okay, the drug has to penetrate, okay, through the entire skin and reach the systemic circulation, and then the destiny, whichever it may be the brain, it may be the heart, okay, whichever organ you are trying to pass. Is it clear? Are you able to understand? Yes?
Yes, sir. Yes, sir.
And more big advantage feature of transdermal delivery is you are bypassing the first pass metabolism. You are preventing the drug from going into the liver. Okay, where many a time what will happen is almost 50% or even more amount of drug will get destroyed once it goes to the liver because of what? Any answer?
Metabolic enzymes.
Yes, very much true. Okay, that is what is biochemistry, what the people are studying. Okay, because of what you can call it as hepatic first pass metabolism. So that 50% you are conserving. Diclofenac example is a classical example where diclofenac sodium, where 50% of the drug is metabolized. Okay, so instead of giving 50 mg, you can manage the same with 25 mg. It's a patch. Is it clear now?
Yes, sir.
That's crystal clear now, hopefully. So when it
Yes,
comes
sir.
to, good. That is what I want from you people. Okay. So when it comes to system design, what are the components of a transdermal patch? One is the polymer, the other is a drug. You need adhesive so that it sticks to the, just remember your bindi or just remember the band-aid. So you need adhesive, but you also need a penetration enhancer sometimes. You also need a backing membrane. Backing membrane is the back of your transdermal patch. I'll show you the different layers. And one more is the release liner. Okay. So these are the major components of the transdermal system. Okay. I'll be covering the rest of the system, rest of the types of transdermal patches in the next class. Okay. Hopefully, most of you would have understood. Okay. What is transdermal? In depth also I have gone. Is it clear? Have you
Yes,
understood?
sir.
After all this circus, okay, please encash whatever you are trying to hear. Okay, please focus. Please jot down. Very important. Yes, please note down the points. Finally clear the PPT. Not a problem. Is it clear? Yes?
Yes, sir.
Okay, man. Yes. See you in the next class probably. Okay? Take care. Yeah. Bye.
Thank you,
Bye.
sir.
Bye. 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 Bye.